2% of people spend their childhood in poverty. Do you know what kind of effect that can have on children later in life? The longer the time a child spends in poverty, the more difficult the rest of life becomes. According to an analysis by Columbia University's National Center for Children in Poverty, 45% of people who spend at least half of their childhood in poverty were poor at age 35. Among those who spent less than half of their childhood in poverty, just 8% were poor at the age of 35. In an article titled "The Rise of Childhood Poverty in Georgia," poverty is shown to be a serious issue as Georgia is seeing an increase in poverty levels as evidenced by increased and free and reduced lunch rates for students. An important topic this source raises concerning whether or not the schools are doing enough to help the poverty crisis. Studies also show as evidence in the source that effects of poverty begin as early as first grade. At-risk students receive more discipline referrals even at that young of age. Poverty can also lead to an increase of anxiety, depression, and negative emotional actions in children and adults. According to income, poverty, and health insurance coverage in the United States in 2011, the nation's poorest kids primarily lived in households headed by a single female. Nearly half of all children with a single mother live in poverty. Indeed, the children of single mothers experience poverty at a rate that is more than 4 times higher than kids in married couple families. A revitalized food program needs to be developed for children and families living in poverty. I'm here to tell you about the effects of poverty and how an improved program would positively impact these families. Also, an increased emphasis on the use of community gardens to provide fresh and healthy food for these people. Supplemental Nutrition Assistance Program, formerly referred to as the Food Stamp Program, provides help for low-income people to purchase food. The SNAP program is an outdated way of helping people who are in poverty. In fact, I do not think it helps at all. Rather, it continues the circle of poverty and poor health rather than improving it. According to snaphealth.org, many critics of the SNAP program have accused it of encouraging unhealthy eating habits among its participants and contributing to increasing rates of obesity in the United States. Such critics believe that mere distribution of food assistance leads to SNAP recipients to buy more food, which results in higher consumption among the SNAP population. Others think that foods high in sugar and fat content contribute to minimal nutritional value, and they are cheaper and therefore more likely to be purchased with the SNAP benefits. SNAP is a program with several problems. It has very high administrative costs and lots of fraud and abuse. The requirements of the program are often not followed, it results in an ineffective program. Receiving these food stamp benefits can cause many people to not work because these benefits are handed out for free. This can cause people to become dependent on this program and never want to work. This program is also very susceptible to people taking advantage of it. If people with the SNAP program do not budget well, the benefits could run out, leaving them with no food for the rest of the month. Our proposal is to totally change and revamp the SNAP program. My first solution would be to put more restrictions on what people can buy with food stamps and what people can be eligible for them. I would propose that food stamps can only purchase healthy foods to be determined by the Food and Health Administration. I would also propose that each recipient of food stamps be drug tested and show proof that they had been applying for jobs. This would try to eliminate the free riders of this program. Also, each person would be required to go through a financial budgeting class to learn to make sure their food stamps lasted the whole month. This class would be very beneficial because it would teach them to manage their food stamps and their actual money when they get off the program. Now that I've talked about the revamping the SNAP program, I have another idea for helping people in poverty to have healthier and cheaper food options. From an article entitled "Urban Agriculture Alleviates Effects of Poverty," the availability of affordable and healthy food can reduce food insecurity for people in poverty. When the basic need for food is met, children are more likely to be born healthier and are better prepared for school. Another solution besides a new SNAP program would be an increase of community gardens and expanding farm-to-table initiatives. Community gardens would provide an affordable way for low-income people to purchase healthier foods. Fruits and vegetables from the community gardens can lead to better health and help fight health conditions including obesity and diabetes. Community gardens are a cheaper option because the farmers can sell their own fruits and vegetables to families without having to pay grocery store costs. Also from the article "Urban Agriculture Alleviates Effects of Poverty," farm-to-table initiatives are important because it allows buying directly from area growers that would ensure food freshness and food seasonality while contributing to the local economy. Farmers would benefit from this program because they would always have a way to sell their products. Keeping the money in the local community will help support the local economy. people buying the products from these farmers markets would benefit because they are getting lower costing and healthier, fresher foods. Another part of the revised SNAP program would be allowing the participants to work with local farmers assisting in the cultivation and harvesting of these foods. Like I said earlier, they are required to show proof of applying for these jobs, so this would be a way to get these people working. As you can see, there are a lot of problems with the current situation regarding families in poverty and their food issues. I think we can all agree that the current SNAP program needs some changes. I believe that the changes that I proposed to the SNAP program could help change these people's lives and improve their health greatly. Increase of community gardens and local farmers markets would not only help the people buying this food, but also the community as a whole.